CDCR is eager to reintroduce in-person visiting after making the tough decision to suspend the program due to the COVID-19 pandemic. This instructional video has been made to help explain the new visiting protocols for your in-person visit. These materials were created in coordination with public health and healthcare experts and are aimed at protecting the health and safety of all those who live and work in our state prisons and the community at large. For a detailed explanation of how to reserve your in-person visit, please see CDCR's visiting webpage at www.cdcr.ca.gov/visitors/visitation-FAQs. Once you have reserved your in-person visit, make sure to continuously check the CDCR Visiting Facility Status webpage to make sure the institution is still open for in-person visiting. As always, an institution may cancel visiting at any time for a number of health and safety reasons. Due to the additional check-in and processing procedures for in-person visiting, it is very important to arrive at least an hour before your scheduled visit. All visits will begin and end as scheduled to allow for cleaning and other visitors. No additional time will be provided due to processing and testing delays. Once you arrive at the institution, you will be asked to undergo both a verbal symptom screening and a touchless temperature check.
Good morning. Have you been tested for COVID in the last 7 days?
Yes, I have.
And are you having any unusual fatigue, headaches, or body aches?
No.
And any COVID symptoms in the last 10 days?
No.
And any exposure in the last 14 days?
No.
All right.
You will also be provided and required to wear a procedure mask, also called a surgical mask, throughout the duration of your visit. This is mandatory and no exceptions will be made. Additionally, you will be required to show proof of a negative viral or point-of-care COVID-19 test taken no longer than 72 hours prior to the visit. Test must be either a polymerase chain reaction PCR test or a rapid point-of-care POC test. Antibody tests will not be accepted. If you do not have proof of a negative COVID-19 test within 72 hours of your visit, you will be required to undergo a point-of-care rapid response COVID-19 test provided by healthcare staff prior to entry into the institution. It is highly recommended that you obtain a negative COVID-19 test before arrival to avoid any delays in your visit. Testing time frames at the institution could take longer than expected if you wait to get tested at that institution, which could mean less time for your scheduled visit. If the test returns positive, you will not be allowed entry into the institution and will be instructed to leave state grounds. Upon completing all entrance screening, you will be processed through to the visitation location. Please be aware that you may need to remove your mask briefly for identification purposes when moving about the institution. If the institution you are visiting requires additional transportation to the visiting facility, CDCR has reduced the capacity of transportation vehicles to at least 75% to allow for adequate physical distancing. Masks are required during the entire transport. This is also important to remember when arriving at the institution at least an hour before your scheduled visit to ensure adequate time for processing and transportation. Once inside the visiting location, you will be allowed a brief embrace at the beginning of your visit with your loved one. Mask will be required for the duration of the visit for both visitors and the incarcerated population. There are no exceptions. In-person visits are 1 hour in duration. Visiting slots will be spaced apart in 90-minute increments to allow time for cleaning between visits, but the visit itself will be 60 minutes in length. Some additional changes to in-person visiting include no vending machine items will be available for purchase, no photo ducats, no childcare will be provided at this time due to physical distancing requirements. To accommodate the limited visiting schedule, all visits will begin and end at the scheduled appointment time with no exceptions. After the visit with your loved one, you may briefly embrace to say goodbye and will be directed on how to safely and securely exit institution grounds. CDCR hopes to increase visiting just as soon as we safely can, including eventually allowing minors to visit and increasing the amount of visiting time. The phased reopening allows us to be able to physically distance individuals, properly clean between visits, and fulfill testing requirements. Thank you for your continued patience and understanding.